So my disclaimer, the views expressed in this presentation are those of the authors and do not necessarily reflect the views or policies of the US EPA. And now that that's out of the way, I'll go into the talk. So I'm going to tell you first about what we do in the IRIS program that I work in, and then focus the talk on some of the tools that we use to do that work. So it's a little bit different in flavor than some of the other presentations. So as many of you might be aware, EPA's Integrated Risk Information System, or IRIS program, develops a database of health effects information for hundreds of environmental pollutants. IRIS assessments focus on toxicity due to chronic or lifetime exposure, and as well as hazard identification, we also produce toxicity values through dose response assessment for both cancer and non-cancer effects. So importantly, IRIS products and assessments do not have a regulatory impact themselves, but underlay EPA decisions including health-based standards, cleanup levels at contaminated sites, and also support various legal acts such as the Clean Air Act, Safe Drinking Water Act, and so on. So this flowchart shows the process that we follow to develop our IRIS assessments. It's a systematic review-based process. We start with scoping and problem formulation. That's informed by our stakeholders, usually agency programs and offices. They may tell us, for example, that we need a toxicity value for non-cancer effects for the oral route of exposure. So input like that is used to kind of scope out what we need to do in the assessment. That informs our literature search, screening, and inventory strategy. We specify our assessment approach once we see what the database of the literature has to offer. We move through study evaluation, extraction of results. We then move to an evidence synthesis phase where we take the evidence from a single stream, so for example, all human studies or all animal studies, to arrive at a determination of the evidence. And then we draw all those streams together in evidence integration, along with mechanistic information to arrive at a causal hazard conclusion.
Sorry, can we ask you?
Oh.
Close it.
Sure. And so once we've arrived at a hazard determination and conclude that a hazard is present, we look to see if there are any studies that are suitable for dose response evaluation and move to derivation of toxicity values. So I said this is a systematic review-based process, and we have heard, for example, those of you who were in the workshops yesterday heard that it can take anywhere from half an hour for a very trained evaluator to half a day for somebody who is learning the process and the tools to do just one step of that study evaluation. So this is a very time-intensive, resource-intensive development process, but we believe it's really foundational both for the quality of our assessments, for transparency, and public trust. So fortunately, we do have a lot of software applications and tools that can help us to streamline parts of the process, to improve user interface, UI, user interactions, UX, standardized data exchange formats, and in some cases utilize artificial intelligence for semi-automation for certain of those steps. So for the presentation today, I'm going to be focusing on how the IRIS program uses the Health Assessment Workspace Collaborative, or HAWC, focusing specifically on how we utilize some data extraction features that have recently been updated to make the extraction of epidemiology data more flexible and usable. So the Health Assessment Workspace Collaborative, or HAWC, is a web-based content management system for human health data. What I'll be talking about today is specific to the EPA's deployment of HAWC, which is shown here. However, HAWC is used by other agencies and bodies such as the National Toxicology Program, WHO, Cal EPA, and others. And if you're interested in using HAWC for your own purposes, it is an open source Python application. The source code is available on GitHub. And if you want to see how EPA uses it, hawc.epa.gov is where you would want to go to check that out. HAWC does have tiered access, so we can manage read-write, as well as make information public when we do release assessments in our other products. So some of the key modules in HAWC that we use for the IRIS process include the literature screening, literature inventory, risk of bias and study evaluation, and data extraction both for animal and human studies. And these extracted data can then be used to create interactive summary tables and visualizations. So there are just a few screenshots shown here, and I'll walk through some of these applications in the coming slides. So specifically for epidemiology data, at different points in the assessment, when we're doing the literature inventory to see what data do we have, when we are looking at study evaluation, when we're extracting quantitative results, we need different data extraction components. So things like study design features, identifying information for the chemicals that are evaluated in that study, the exposure context, so the route of exposure, exposure source, distribution of exposure in the population, what are the potential confounders or effect modifiers that were considered in the study, what are the specific outcomes that are being looked at, and then the quantitative results, so relative risks and variance estimates. So the extraction features in Hawk that we use to house all these data have been recently upgraded, so they're much more flexible. We can use them to create different products, including evidence maps, talks reviews, visualizations, and port information in and out of Hawk into other software tools. So I'm just going to walk through a few examples of how we use these extracted epidemiology data in Hawk. And one application is evidence maps. So evidence maps are high-level summaries of the available literature, and these are largely used at the preliminary phases when we're doing our scoping and problem formulation, because evidence maps allow us to use tailored criteria, so things like PICO statements, to identify and categorize the available literature, and relatively quickly, identify data gaps, characterize the level of effort that's going to be needed for the assessment, and the needed expertise. So the screenshot that is shown here is from an evidence map for PFAS. And you can see on the left, the heat map shows an array of the number of studies by health effect category and by population in the study. So you can really quickly see, for example, that, there are a lot of studies looking at immune effects or developmental effects, but there's very few studies looking at something like urinary system effects. And we can kind of very quickly summarize the data in terms of the chemicals that were assessed, the study confidence from the risk of bias evaluation, and so on. So that's kind of at the preliminary stage when we're doing the scoping and problem formulation. But for the more full-fledged toxicological reviews, or what I have been referring to as the IRIS assessments, here's an example of a homepage for the IRIS program's tox review of perfluorohexanoic acid, or PFHXA. And you can see on the left-hand side the drop-down from the Hawk page, the different modules that are available, so literature review, the study evaluation, the list of studies that were included, visualizations, and summary tables. So I mentioned that one of the key features of Hawk and the way that we extract data into Hawk is the interoperability with other tools. And for example, we use different tools, including Swift Review and Swift Active Screener, Distiller for things like title abstract screening and full text screening. We are dipping our toes into using artificial intelligence with tools such as Dexter, Laser AI for automating certain elements of data extraction. So the outputs from each of these softwares and others can be ported into Hawk, which is really convenient. And then what we put into Hawk can then be put out, so we can use it for things like visualizations and Tableau. So being able to move data through these different software applications has been a great time saver for staff. And now I'm going to just show some screenshots of the epidemiology data extraction module. So how do we get all that data that underlays those nice tables and visualizations and evidence maps and so on? So these are some of the forms that are included in that module. So this is the chemical identifying information and the exposure information. So you can see you can include information such as the type, if it's a biomarker, for example, or a media measurement, the timing of measurement, there we go, and other details such as the distribution of exposure in the population. This is the study population and study design form within the extraction module. So we have information on the study design, the source, if it's a certain age category, information on inclusion-exclusion criteria, susceptibility or vulnerable populations, and other information. And what's shown here are the additional formats for adjustment factors. I mentioned potential confounders and effect modifiers that the study looked at, and extraction for the quantitative results, in this case looking at relative risks for changes in birth weight, I believe it is, with increases in maternal serum levels of vanadium. So once we've done the work of extracting all those data, we can build very useful visualizations like the heat map shown here. Again, similar to the evidence map for PFAS, this is showing health effects looked at in different studies, arrayed by the specific chemical being looked at. We also have the ability to query our data, so we can quickly see how many studies looked at blood pressure, for example. And we can build data pivots like this one to show information extracted across studies that looked at similar endpoints, for example. So this is a nice example showing a forest plot of effects on birth weight with PFAS from a number of different studies, including information like the overall study confidence and study design. So for those of you who are more programming or computer-oriented than I am, we did want to mention that when we're rebuilding or revamping the data extraction modules, we added an application programming interface, or API, to be able to create all the objects. And very exciting for users, there's now a bulk cleanup feature, so we can more easily standardize the data that are extracted to make our visualizations and tables and so on more uniform and more tidy. So here's just a couple more examples of interactive visuals. You can't see it here on the static version, but if you were to click on any of the dots or the study name in this type of visual within Hawk, it would actually pop up more information that was extracted from that study. And you'd be able to then go and find, for that study, what was the risk of bias or the study evaluation. So for example, here you can see that we use a color-coded schema to show our evaluation for different domains, including participant selection, selective reporting, and overall confidence. And if you were to click on the little boxes, it would pop up the text rationale that underlay that decision. And finally, just one more example showing some of the extracted data and how it's housed in terms of the quantitative results. So in summary, the IRIS program develops a number of different products, including our IRIS assessments or toxicological reviews. We use systematic review methods because we believe that it's really important for transparency and quality, but they are very time and resource intensive. So we try to use tools such as Hawk when we can to streamline and make our products easier to develop for staff. And in particular, the Hawk data extraction module that has been recently updated has been a really great advancement for us in terms of flexibility and interoperability with other tools. So I'd like to take a moment to acknowledge all of the contributors, including the Hawk team that's shown here, and co-authors and infrastructure and support. And I neglected to put my email here, but it's just my name, christensen.krista@epa.gov, if you have any further questions. Thank you.